Hi, guys. Today I have a special guest, a nurse practitioner for Hackensack Meridian Hackensack Hospital in Hackensack, New Jersey, Carmen Peralta. Thank you, Carmen, for being here today with me.
Thank you for having me.
So I've been interviewing a few people during coronavirus crisis, and I have not talked to a nurse or anybody in the medical field yet. Well, actually, I did interview a doctor, vascular doctor, in my first interview. But from the front lines, what has your experience been since this crisis started?
Where to begin? It's been a very intense experience, very anxiety provoking, especially at the beginning, because there were many fears about not only catching the virus, but bringing the virus home to my family. So it's something that still stays with me, but it's getting a little better as the numbers are trending down.
In that sense, let me ask you, what did you do to prevent, say, from either you catching it or both bringing it to your family, your loved ones, your home?
There were a number of things that we, as an institution, did. First of all, I went to work. I changed into surgical scrubs. There's specialized medical equipment that we have to put on. We have to don and doff this equipment in a specific sequence in order to protect ourselves and our patients. So we had to wear specialized N95 masks, facial shields, gowns, gloves, in many cases, foot coverings, just to protect ourselves.
Right. A lot of people sometimes, think of hazmat and firefighters, when they have to hose down. I mean, I don't know if that was your case, but did you have to, for instance, I don't know, bring a change of clothes to the hospital? Did you come home and not sleep in your own room or in the basement?
Yeah, absolutely. Yeah, I changed before I came home. I, came home, showered immediately. You're Purelling your steering wheel, washing your hands 100 times a day. You're trying to do everything to ensure, that protecting yourself from the virus and to prevent you from spreading that to others around you.
And from what I gather, neither you or your family were infected due to the precautions that you took.
Thank God, no. No, we're all healthy, thank goodness.
Now, some of the critical aspects of this disease, you were saying earlier off camera, was that a lot of patients basically died alone. Explain to us why this was.
Well, due to the visitor restrictions that were imposed because of COVID-19, many of these patients arrived to the hospital so critically ill, they were almost to the point of dying. And the illness trajectory took place so rapidly that the patients quite often died alone without the families having an opportunity to get to them. Quite often, we as palliative care practitioners try to facilitate FaceTiming with the families. We had many serious end-of-life conversations on the phone. If the patient couldn't speak to us, we had to speak to the families about it. And it was such a surreal, awful experience, actually, because you're having these conversations with the families about their loved ones dying, and they saw them alive and well not even hours before. It was very intense.
I'm glad actually you brought the fact that you're a palliative care nurse practitioner, which a lot of people sometimes, when we speak of nurses, you're up there with a doctor, except the fact you cannot do surgeries, but you can prescribe medications. And to that point, as a palliative nurse practitioner, medications that you were prescribing, not so much for the treatment of COVID-19 itself, but for an end-of-life type of scenario that you were speaking of. This would help because you were saying off camera again on our pre-interview that dying from COVID-19 is like basically drowning.
It is. Quite often the treatments that we initiated for these patients, such to help them with their shortness of breath, with their pain, those treatments were resistant. The symptoms were just refractory, and the patients were not responding to the treatments that we started. So we had to bump up the doses, and quite often the patients, were sedated at the end of their lives, because that was the only way to ensure their comfort.
Right. In essence, they passing away in their sleep, if that's a human way of putting it. I mean, in the comfort of their sleep, if you could call it that.
The goal was to ensure their comfort, to optimize their comfort, to control their symptoms as best we could. And we tried to do the best we could at that time.
Right. Now, in our conversation, we have been speaking mostly in the past tense, because now it has been 12 weeks, I guess, or a little bit more since this started. And how are things now at the level that we are in June 11th?
Definitely things are getting better. The numbers have trended down, but we know we can't let our guard down. And we still have visitor restrictions for the safety of our patients who are in the hospital. And we are still using our protective equipment, personalized protective equipment. We still change into scrubs. So we're still following the same protocols that we were following during the crisis.
Right. Now, I have to say that I personally, and I think a lot of people who have stayed home for whatever reasons, have to admire the work that you've guys done. You're heroes to us. Now, I don't want to put you on the spot, but there are sayings that there might be a second wave. Who knows? Maybe in the fall, sometimes in the winter. How true is this, and how prepared are we now that we know what's happening?
There's so many question marks. It's so hard to say, but we have to be prepared for a resurgence. We can't let our guard down, because there are too many unknowns. And until we have a vaccine or an antidote in place, we can't take it for granted that it's not going to come back.
Right. Well, Carmen, thank you for the interview. Fellow Fordham University graduate and nurse practitioner in palliative care at Hackensack Meridian Hospital. Thank you, Carmen.
Thank you so much. It's been a pleasure talking to you.